When a person has cataracts, sometimes the first thing that you will notice is that it becomes really hard to read in certain lighting conditions. Driving at night will become difficult. Your brain adjusts to it, so you may not even realize that you're not seeing as well as you could. And what happens when we do cataract surgery is we always do one eye at a time. So patients will often say to me that they cover the eye that hasn't been corrected, or they look through the eye that had surgery and the colors are so vibrant and they didn't realize that their wall was white. They thought it was like a yellow. And then when they look with the other eye, the colors are much more dull. Once you've had both eyes done, you don't get to have that experience. But after surgery, vision is obviously better, and then colors, the ability to function, light, everything is going to be brighter. If cataracts are left untreated, meaning you don't have cataract surgery, they don't go away. So cataracts will continue to grow and you'll continue to have difficulty with your vision. So getting new glasses or contacts, it's not really going to help. What you need is cataract surgery. There's a time when we'll say, okay, you're ready for cataract surgery. And that means it's the perfect time. Your cataracts are ripe, like a piece of fruit. So the risks are as low as they possibly could be. And the benefit of having surgery will really improve your vision. So we try to do it around that time because we don't want them to get too big and then your recovery can be much longer and surgery can be much more complex. Can cataracts go away on their own? Unfortunately not. Cataracts will continue to grow if they're not treated, and the only treatment we have for cataracts is cataract surgery. The only way to treat your cataracts is by doing surgery. Without surgery, they will continue to grow. Does cataracts affect one or both eyes? It typically affects both eyes. You may have one eye that's more affected than the other and have surgery on that eye first, and that's totally normal.